bill that I filed is House Bill 340, and what it does is it eases access, it removes a regulatory barrier for school-based telehealth. And for those of you familiar with telehealth, it's basically video conferencing between a patient and a medical specialist on the other end. Part of my career background has been in the social service field, along with higher education. And during my time in the social service field, I often saw kids in a single parent household where the parent was working 2 or 3 part-time jobs trying to make ends meet. If that parent took off work to take their child who has a chronic health condition to work, that means losing hours at work, that means losing pay, sometimes that meant maybe losing a job. I grew up in Monroe City, Missouri, northeast Missouri, and seeing a medical specialist sometimes meant you're driving 2 or 3 hours one way, waiting 45 minutes to an hour in the doctor's office just to see a doctor for 10, 15 minutes for something routine. What my bill will do is it will allow for physicians, medical specialists, and other healthcare providers to seek reimbursement through Medicaid for school-based telehealth. We're not going to mandate schools do this. We just want to remove the barrier so that more schools that choose to implement this program can provide better access for our children to receive adequate health care. The chronic health issues that are currently facing our children are quite alarming. The CDC reports that close to 10% of our children in the United States have a chronic health issue. If you add in childhood obesity on top of that, which the CDC doesn't consider that right now in their 10%, it's closer to 20% of our youth have a chronic health issue. That's compared to about 2% in the 1960s. This is not the trend that we want to see. We need to continue to do everything we can to ease access and provide better quality care to our kids. Because it doesn't only mean better health outcomes, it also means better learning outcomes as well. Going around talking to teachers around the district, I heard time and time again that behavioral health, mental health issues were not only disruptive for the child in the classroom dealing with this illness, but it also affected the other kids in the classroom wanting to learn. It affected the teacher's ability to be able to teach in that classroom. So again, I'm passionate about this. This is a pretty straightforward bill. I hope to keep it clean. Who knows, maybe I can pass it, but worst case scenario, maybe I can add as an amendment to something similar and we can get it through this year, and then we can work on getting this implemented around the state. So thank you very much for your time. I'm going to work hard. I don't care that I'm a super minority. I'm going to work hard with both parties to make sure that we're representing the University of Missouri well, and that the state of Missouri, the entire state of Missouri, understands that the investment is money well spent, and we will continue to reap the rewards of a well-funded institution. So thank you very much.